presentation today, so I'm just going to make sure I keep my time going too, so I keep on time here. So I'm just going to talk to you for a few minutes about the Masters of Physiotherapy Studies program at the University of Queensland, and I'm the program director of that program as well. So just a little bit about UQ. So UQ, this is basically a picture of UQ, and that's the Great Court in UQ, which is one of the kind of most famous landmarks around the UQ area. So it's a beautiful sandstone university that is what they call the group of 8 universities in Australia, which is one of the original 8 sandstone universities. UQ is ranked top 50 in the world in the universities and 3rd in the world for sports-related subjects. And that's nice for me because I'm a sports physiotherapist. That's my background as I work in sports and exercise. So you probably all know where Australia is, obviously, and UQ is located pretty much on the middle of the east coast of Australia. This is Brisbane, and these are some of the things that you see around Brisbane. So just to give you some perspective of where Queensland is, and I realize it looks quite different from the way Canada might look right now, since you guys are in the middle of winter and we're in the middle of summer. So you'd enjoy a nice change of scenery at UQ and in Brisbane. So just to move on to talk about the program here. So at UQ, we run 4 different physiotherapy programs. We have a Bachelor of Physiotherapy program, which is a 4-year degree. We have the Masters of Physiotherapy Studies, which you guys are interested in, which is our 2-year degree that you complete after you've completed a bachelor degree. We also have a Masters of Physiotherapy in musculoskeletal or sports physiotherapy. And then we have physiotherapy research degrees, so masters or PhDs in research. So at the UQ, you meet students and see students from all of these different programs. So I can answer any questions about any other programs you might be interested in as well. So the Masters of Physiotherapy Studies is an accelerated program for people who have a bachelor degree that runs over a 2-year period. So the semesters of that period is we start the program in November of the year, and we have our first semester is a summer semester, which is 8 weeks long. And in that summer semester, you do 2 courses. We then have what we call semester 1, and that runs from March to June. So we've just started our semester 1. So currently we're in week 2 of semester 1. And that program, that semester is 14 weeks, and you do 4 courses in that time frame. Our third semester then is semester 2, and that runs from August until November. It's another 13-week semester where you do 4 courses. And between semesters 1 and 2, there's a month break. So basically the month of July is a holiday month for all students in the program. Now this is what the years look like. So the first year in your summer semester, you do really some introductory skills in physiotherapy. In semester 1, you have courses on musculoskeletal and sports physiotherapy. So I teach you guys a lot in semester 1 in the sports physiotherapy area. And then you have courses in orthopedics and pain, and you have an introduction to research course. In your semester 2, you continue with further musculoskeletal and sports physiotherapy courses. You do cardiorespiratory physiotherapy, aging and geriatrics, and women's and men's health. So you can see you're getting quite a range of different areas of physiotherapy, which we obviously cover all areas throughout the program. And then in your second year of the program, so the second year is the same layout as the first year, but obviously different course content. So in the second year, you have courses that are on occupational health, in telehealth. So we have a really large telehealth facility here, which similar to Canada, Australia is very spread out. So we use telehealth to service people who are not able to get to major cities for their physiotherapy management. And we do a program called Standardized Patients, which I'll talk about in a few minutes. And we commence your clinical placements, your larger clinical placements in your second year. So in your first year, you have what we call clinical visits or clinical experiences, which are shorter, like 1 day or half day. And then as we go into year 2, you get longer, like 3-week to 5-week clinical placements. In year 2 and in the first semester, you also do neurology, pediatrics, and research. And then you finish your degree with a series of 5-week clinical placements to really apply all of the things you've learned throughout your degree into clinical practice. So in terms of how you learn in the program, so we have practical classes in which you learn practical skills, lots of hands-on techniques. We have a lot of clinical reasoning activities. Sorry, I'm trying to move me over, but that's making my slides move. We have a lot of clinical reasoning activities where we either work through problem solving certain cases as a group, Or we do go into clinic for visits, and we work with patients in clinics to help our clinical reasoning and problem solving in terms of diagnosing what a patient's condition might be and figuring out how we can best treat that. And we have a whole area on simulation. So I mentioned that in your second year, you have something called standardized patients. And that's a simulation program where we bring actors in, and actors role play patients. So you can see in the bottom picture there, the person lying in the bed is an actor with all of the tubes and everything else you'd have in a hospital setting. So this simulation is a way for students to practice being a physiotherapist in a hospital or a clinic without the risk and scare of all the serious pathologies and diseases that are present. So basically, it gives students a chance to practice techniques and make a mistake without any consequences to a patient. So this is our simulation program has actually won a lot of awards internationally and nationally in terms of its ability to prepare students for clinical practice. So that's something that you'll do a lot of scattered throughout the program, but also in a big block in your second year as well. I mentioned that you have a lot of clinical practice or clinical placements, we call it. And again, that's a lot throughout your second year of the program and also scattered throughout your first year. Now, our clinical practice, we have a number of clinics in our school that you get experience with, as well as hospitals and clinics outside of our school. So our UQ Health and Rehabilitation clinics, we have a musculoskeletal and sports injury clinic. We have a neurology, aging, and balance clinic. And that's obviously those names probably tell you what happens in those clinics. We have a healthy living clinic, and that clinic is designed for people over 45 years of age and we're looking at lifestyle changes and addressing risk factors for injuries and any injuries affecting that age group. And we have a pediatric clinic, also probably quite self-explanatory. And we have a tele-rehabilitation clinic where, again, we service people who live in rural and remote Australia and can't get to major cities. So you'll get experiences throughout our internal clinics throughout your program, as well as in your larger clinical placements. Other clinical placements that we offer, we have international clinical placements. And things have been on hold with COVID in light of borders being closed and travel not being allowed or very easy to do. But in normal circumstances, we would have placements in Canada, in Belgium. So we have an exchange program with Ghent in Belgium. So we send some students over to Ghent. We also have an exchange program with Glasgow in Scotland. And we also obviously send students over to Glasgow. And then we send 2 teams of students over to Vietnam and Timor-Leste. And in those locations, we're basically delivering physiotherapy services with speech pathology and occupational therapy. So we would go as a healthcare team, and we deliver these services to underprivileged areas to really help develop the physiotherapy in those countries and often give you experiences working with different cultures and in different environments. So just some really attractive clinical placement options that many of our students take up. So just a few other things about our program before we wrap up. We have a lot of world leaders in research and in teaching in our program. So we have people who have won international awards for research and are fellows of of research in Australia. We also offer research internships and scholarships for students who want to get more research experience and work with some of these leading researchers in the field of physiotherapy. So you can do that either in your holiday blocks throughout their program, or you can do it as throughout your program during the semesters as well. Many of our teachers are clinical and education experts. So in Australia, we have who we call specialists and title holders in physiotherapy. So title holders are people who, I guess, are titled to be kind of specialists in a certain area of physiotherapy. And one step above that is a specialist, like a fellow or a specialist in a certain area of physiotherapy. And these are recognized as clinical experts in these areas. And we have many of these people who come in and teach in the program. So you're learning from experts in the field. So as an example, I'm a title holder for sports and exercise physiotherapists. And most people that teach in the courses that I run with you are also those specialists. So you get taught from people who have really high level of expertise. There's also extension learning opportunities there too, where you can go to the private practices where some of these people work and get some other experience and some observations to see how their clinics go and what they do as physiotherapists. We have a high student to staff teaching ratio in our practical classes to make sure that you get really good feedback on your skills. And we have excellent teaching scores and excellent employment rates. So the last thing I'm going to finish up with is just a few quotes from our students, just so you can kind of hear their perspective on our program. Some of the things we're really proud of is that they recognize that we really make the program really clinical, that we're bringing people in who are going to teach you to be the best physiotherapist you can be, and the community and support that we provide for the students from both locally and in the global perspective. So that wraps up the formal presentation for now. I'm not sure if it's easier for me to stop share, Chris, for questions. What do you prefer?
I think it's okay to leave the screen up if you like. I just wanted to mention to everyone that our students love the physio program at UQ. They have a really positive experience, and we do large surveys for students that are well into their program, and I can tell you that the feedback we get is overwhelmingly positive. Brisbane's an amazing town, and the St. Lucia campus is just, I mean, it's more beautiful than it looks in the slides. So I just wanted to reference that and perhaps dovetail that on a question to Michelle or Natalia, like in terms of student support, how do the Canadians perform in your program?
Yeah, they do really well in our program. So I guess we get feedback from a number of different avenues with that. So obviously we had the students do well from a GPA perspective. So they're doing well performing academically, and they do well in their clinical placements, which is really showing how well the students are going to perform as a physiotherapist. It's interesting because at the beginning of our program, all students plan to go back to Canada. At the end of the program, it's a bit more mixed than that. A number of people do stay in Australia, and all of those students who stay in Australia do get jobs. They get great jobs here. So they're obviously very employable. And the students who go back to Canada, they all successfully complete their physiotherapy exams there too. So I tried to get feedback from the Alliance just to make sure that, we're preparing our students appropriately for their exams. And they've indicated that our students are very high performing, and they've never had anyone who's not successfully completed that exam.
Fantastic. And the Alliance Dr. Smith refers to as the governing body.
In Canada, yeah.
You have to deal with upon graduation and coming back. So there's one question, and I'm going to put you under the gun. We have about 1 minute to answer it. Question from Caitlin Schwartz. Are there any placement or shadow opportunities in female or / pelvic health at UQ?
Yeah, there are. So first you take coursework in that area in I guess it's your third semester of your program. You have a whole section of a course dedicated to that area. And then students get to preference specialty areas they'd like to work in their clinical placements. And we have a number of women's health physios who do offer those specialist placements. And we also have some very expert individuals who run podcasts internationally that they may have heard of that also lecture and come into our program, as well as offer clinical opportunities. So lots of opportunity in that space.
Fantastic. Listen, thank you. Really appreciate this session. Sarah, sorry to cut you off. There's a question about competitive GPA for the last intake. We can certainly answer that at the OzTREKK booth, or we can answer it in the UQ booth, certainly. On the Career Echo. So thank you, Dr. Smith. Thank you, Natalia. And thank you, everyone, for attending.
Great. Thanks for having us, Chris.
Thank you, everyone.
Cheers.
Bye, everyone.
Bye.